Well, before my diagnosis, I was at work and I was coughing, and it got to where it hurt to cough. He asked if he could do an x-ray. Well, it just went. The next day he called me and said I had pneumonia and told me he wanted me to check back in with him or my doctor. So when I got done with that, I went to my doctor and I told him it still hurt after going through all the medication. So then he had me do more x-rays and it just spiraled from there. He made me go to see a lung specialist. So it was like August 15th, September 30th, I found out I had lung cancer.
Well, I was diagnosed with cancer in May of 2009, and at that time I was kind of leading a fairly normal life working, and in my trip overseas I started feeling different, having to go to the restroom more frequently than usual, and they did a series of tests, and that's when they, especially a colonoscopy, and that's when they discovered that I did have colon cancer.
My experience leading up to being pre-diagnosed with cancer was I was enjoying life. I was recently married 2 years ago and acquired stepchildren and grandkids. So we were all excited. We had spent Thanksgiving with all of our kids and our grandkids. The next day, we found the lump. And everything changed. I immediately called the doctor. The doctor confirmed that yes, you do have a lump. You need to come up and get an ultrasound and a mammogram done, and possibly maybe a biopsy depending on what the mammogram and the ultrasound confirms. 2 days, 3 days later, got the phone call that the biopsy did confirm I had cancer.
Cancer really hasn't changed my lifestyle. I still golf, I still do what I want. I try to stay away from smoke. But other than that, no, I work full time. I try to do with my grandkids, so I don't feel like it's changed that much.
I think cancer has changed my lifestyle quite a bit. Since being diagnosed with cancer in 2009, I really slowed down. Of course, the cancer has caused me to slow down, but I think the biggest difference is I set smaller goals, shorter time frame goals. My daughter got married in 2009, and I really looked forward to that. And then my son got married in June of 2010. So everything is in a shorter time frame than it used to be. I used to think, oh, I'll plan this 10 years from now, but now everything has to come quick.
How has cancer changed or affected my lifestyle? I would say it has made me stronger in my faith. My husband and I attend church, and we're members of the Jasonville Assembly of God Church in Jasonville. And the outpouring of prayers, phone calls, concerns, not only for me, but my husband and my kids. It has been a truly humbling experience.
I know in the back of my mind what I'm facing, but through work and my family and my friends, I'm doing great. I just feel good. I feel fine. My health, I feel fine. Just in the back of my mind, I know what I have. It's going to be tough to take me down.
Since being diagnosed with cancer, some of the things that have really been most difficult is not knowing what's coming next. Every time you get a treatment, it can cause different reactions, and you never really know what kind of reaction you're going to have with a certain treatment. I think I've ended up in the emergency room probably 3 or 4 times from allergic reactions to different medicines. So that's one of the things that is really a little bit scary.
The most difficult thing I've faced with cancer was, I'd say there's probably 2 things. First of all, getting the phone call saying you have cancer, and then wondering in your mind, is it the death sentence or can I survive this? And then, you know, you meet with your team of doctors, who's your surgeon and your oncologist, and they are feeding you all this information, and they're telling you you're going to have chemo. And when I first heard the word chemo, I thought, I'm going to be sick. I'm going to lose my hair. I'm not going to be able to do the normal activities that I'm used to doing. And I had an 18-year-old daughter who was graduating from high school, and I thought, am I going to be able to go to her graduation? Thankfully, with the help of the Lord, I was able to not miss work. I did see my daughter graduate from high school. And yes, I lost my hair, but it didn't bring me down. It was more like a rewarding experience instead of, oh my, I'm gonna lose my hair experience.
My experience with the UAP Oncology team has been wonderful. I love the nurses, I love my doctor. Dr. Cunaparetti he's brutally honest, but he lets me know what I'm facing, and he let me know that I want a good quality of life. And that's what I have, I feel, by coming to UAP Oncology. I love it.
Well, the UAP Oncology team has been probably the one part of this journey that has been the best, because the staff, you know, from the minute you walk in the door, from the receptionist to the people that take your blood, to the nurses, to the doctors, they're the best. And sometimes you have other difficulties, and they have to refer you to somebody else. For instance, I had cataracts, so they referred me to a doctor within the UAP group, and within a month I had both of my cataracts taken out.
The experience I've had with the UAP Oncology, Dr. Mannion and her staff has been truly, truly amazing. The Wabash Valley is very blessed to have the Huck Center here in Terre Haute. Dr. Mannion, not only her, but the receptionist at the second floor, the nurses, the lab technicians, all are very caring, compassionate, understanding. Even though they haven't been through the experience, they're there for you. Not only were they there for me, but they were there for my husband. If my husband had any questions or concerns, if any of my children had questions or concerns, all we had to do was call a number, and they would have been there for us 24 hours a day, 7 days a week.